We're very pleased to be here this morning, March the 1st, to announce the collaborative agreement that has been formed between Bermuda Cancer and Health Center and the Bermuda's Hospital Board in terms of supporting the radiation therapy initiative that has been undertaken by Bermuda Cancer and Health Center. The collaborative agreement is one in which patients will be cared for at both of our facilities, allowing us to optimize the current services that are on the island, and then also with the expertise of Dr. Christopher Fosker, we will have integrated comprehensive care for patients between our two facilities.
So yes, this is a really exciting collaboration, and the opportunity to bring radiation to the island is really important to complete the integrated pathway for cancer patients on the island. And the importance of working together, so reducing the number of health silos on the island and working together with the hospital and with the cancer centre will enhance the healthcare for cancer patients on the island. It's a really exciting opportunity to develop the partnerships and bring things forwards.
Do you want to say anything, Michael?
Any questions, please? Training of the staff that will run it, and that was undertaken at the very beginning when it arrived, I think. How long was that going to take, and when will you?
So we are hoping that we will be fully operational within a year. So we do have current expertise here on the island, Dr. Fosker, who is trained in radiation oncology, and then also the diagnostic imaging team at the hospital, who will also be part of the initial diagnoses of patients. Then we will need to bring in some experts from overseas in terms of actually running the facility. So there is a special level of training that radiation therapists and also physicists must undertake in order to safely operate the equipment.
Have you worked with government on the costing of this for the patient?
We have. We have been tremendously supported by the government, the Minister of Health, the Premier of Bermuda. They certainly have embraced what it is that we are trying to do by bringing these services on the island and providing better access for care. Currently, we know that some people just cannot afford to get off the island or may not have appropriate health insurance in order to go overseas for this treatment. So we have been tremendously well supported by the government.
I imagine the insurance companies are happy with it too.
I believe so, yes. And again, I mean, this becomes a benefit to their patients, to their policyholders, and the fact that we can keep this level of care at home and patients can remain with their families, with their loved ones. They can continue to work. It's just tremendous benefit to our community.
It's going to be here?
It's going to be here, under the parking lot.
Can I
Yes.
ask Dr. Foster a question?
Of course, yeah.
For the man in the street who doesn't probably understand what radiation oncology is all about, could you give us a quick snapshot of what it does?
Yeah, so radiation can be used in a lot of different settings within oncology patients, with cancer patients, and it's often used alongside or before or after surgery or before or after chemotherapy or with chemotherapy. It can be used to cure patients from cancer, it can be used alongside surgery to cure patients of cancer, and it can also be used a lot to help the symptoms of cancer. So it has a lot of different settings within the whole pathway for the cancer patient.
Since you came to join us, have you noticed any trends that were a surprise to you in terms of just how bad cancer is in Bermuda?
There's certainly some unusual cases here. So I remember before arriving talking to some of the oncologists in the past about some of the challenging cases here, and I have been surprised about how difficult some of the cases can be, and some of the family trends are also quite challenging. I think one of the most challenging aspects I've seen are the underinsured and uninsured patients, where I can see a clear benefit for radiation but they're unable to receive it. That's been one of the striking things for me.
So by all criteria, this is a major step forward.
Yes, I think so. I think it really helps complete the treatment pathway for cancer patients here, so they can have everything they need on island for most patients, and it's a really important step to help the community, help the families, help the patients.